sugar, stress, steroids, shampoo. What do you think connects these four words? Yes, they all do start with the letter S, but there's a bit more to it. Since the COVID-19 pandemic ended, I have been very eager to learn about my hormonal well being because I did experience a disruption at that time. And this is how I came to know of terms like follicle stimulating hormone, luteinizing hormone, progesterone, and that together with their more talked about partners, and testosterone, they govern so many aspects of my health. And that it also all exists in one delicate balance. One gets disrupted and it impacts the other. And the causes of what can disrupt one hormone were just everywhere. So, coming back to what I started with, too much sugar, too much stress, the wrong medication, or too much of shampoos with chemicals like parabens have all been linked to potential disruptions in your hormonal health. And when I learned this, I started to feel super overwhelmed because, on one hand, I knew that hormonal imbalances can cause a lot of problems in women, especially heart disease, anxiety, acne, weight gain, and that dreaded word cancer. But on the other hand, how do I live a modern lifestyle and avoid triggers for hormonal imbalances? And if I am to avoid sugar, do yoga, invest in paraben free products, which I'm sure there's a reason for why they're so expensive, but will all of this guarantee a healthy life for me? This is Sonali Acharji, and you are listening to Health Wealth, a podcast that wants to leave you with a better understanding of various health concerns, but not to the point where you start feeling overwhelmed and disheartened. Because when we feel something is too scary or too difficult or just a lost cause, we also lose the motivation to take action. According to the ICMR National Cancer Registry program, around 1 in 9 Indians are expected to face a cancer diagnosis in their lifetime today. In women, breast tumors are the leading cause of cancer in this country. We had about 192,000 new breast cancer cases in 1 year alone, which was in 2022, according to the International Agency for Research on Cancer. And I'll be very honest, I hear this and I fear getting cancer. And when the fear comes, well, me being me, my brain goes, wait, you're getting stressed. That isn't going to be good for your hormones. Calm down or you'll get cancer. So I get stressed about stressing over what stress would do to my health. And when I think about menopause, because I'm in my mid 30s, I really think sometimes that the internet algorithms can hear my thoughts because I am forever coming across ads and articles on the diseases that result from a poorly managed menopausal experience. And breast cancer is one of the top ones. So if you're like me and you want to learn how to be friends with your hormones so that they aren't these internal governor generals you have to constantly keep happy, then this episode is for you. For the next half an hour or so, we are going to have with us Dr. Neil Iyengar. He is a medical oncologist and researcher at the Memorial Sloan Kettering Cancer Center, which does a lot of work, very, very important work, on cancer prevention, diagnosis, and treatment. And the hope is that this conversation will shed some new light so that we can understand the links between hormones and breast cancer and as well understand the disease itself. Hello, Dr. Neil. Thank you so much for joining us.
Thank you. It's my pleasure.
I suppose, with Women's Day coming up, stuff on women and diseases is just everywhere. But very few shine light on some not talked about causes or risk factors for diseases. And I think there's a lot of information, but not necessarily knowledge about breast cancer out there. And, I'm hoping perhaps we can start with, what I ended with menopause and breast cancer. That's a very unique process and journey, and I am completely in the dark about it. So, could you tell me, does menopause link to breast cancer?
That's a great question. And I think that the key word in a lot of your description there is balance. And the balance of not just the hormones in our bodies, but the balance between how those hormones signal the different organs in our bodies and how those hormones are impacted by our lifestyle, and whether or not we're living a lifestyle in which we keep these hormones and other factors like inflammation in check or in balance in our bodies. Menopause is a major lifetime event that disrupts this balance.
Hmm.
But the good news is that we can work to maintain a balance, a new balance after menopause to help to lower the risk of developing breast cancer. It's important to keep in mind, though, that menopause is a lifetime event that's associated with reductions in estrogen development or production in your body. And in some ways, this can be helpful, but in many ways, the drop in estrogen production can be a challenge or can present risks. One of those risks is indeed breast cancer. We know that postmenopausal breast cancer is a very common form of breast cancer.
Hmm.
So certainly keeping this lifetime milestone in mind as a opportunity to really focus on maintaining that balance with
Hmm.
aging is a perspective that I would encourage folks to think about as we think about cancer prevention.
Yeah. And so, what exactly triggers the growth of the tumor? Is it the fact that suddenly my body doesn't have estrogen in it anymore?
Well, you've asked a very complex question, and we think there are many factors
Mm-hmm.
that are contributing to the development of tumors.
Mm-hmm.
Certainly, some of the strongest factors are known genetic mutations. So there are a small portion of the population that have genetic mutations that they've inherited from their parents that can stimulate the growth of breast and other cancers.
Right.
There are other factors that contribute to tumor growth, and one of the strongest factors beyond genetics is environmental exposures, including our lifestyles.
Mm-hmm.
Certainly, things like smoking, alcohol consumption, and excessive caloric intake or obesity are some major risk factors for sparking the pathways that lead to tumor growth.
Yeah. And but when I, as a average layman, Google what can I do to prevent breast cancer during menopause, the internet just throws up so many things. Like I said, sugar and shampoos and perfumes. Don't use this. Don't use that. Um, do I have to account for it all?
It can be very intimidating,
Mm-hmm.
right? When you see all of these various things, how do you live your life when
Yeah.
it seems that
Yeah.
everything can contribute to cancer?
Yeah.
This is where I think it's important to go back to that philosophy of balance and to keep in mind that our bodies evolved and were designed to maintain homeostasis, which is
Mm-hmm.
essentially the scientific word for balance.
Yeah.
And our bodies are incredibly efficient at maintaining that homeostasis. It really takes a chronic lifestyle of imbalance to disrupt our body's own mechanisms of
Mm-hmm.
homeostasis. So some of the strongest things we can do to lower a risk of breast and other cancers is to maintain a healthy lifestyle.
Yeah.
And that is that concept of balance again. So avoiding known carcinogens,
Mm-hmm.
again, smoking, alcohol, and maintaining a healthy nutritional intake. We can talk about what that looks like,
Yeah.
physical
Yeah.
activity, and
Yeah.
so forth.
Yeah.
Those are the key pillars. And then some of these smaller exposures, like various shampoos you brought up, or
Nail
ingredients.
polish.
Yes, yes, certainly.
You know.
Or
Yeah.
processing foods even.
Yeah.
All
Yeah.
of these things add up little by little, but the key is to keep some of the major pillars in
Yeah.
place. That's lifestyle and your health and well-being and
Yeah.
cancer screening.
Yeah. You mentioned nutrition, and that was something I was also very keen to talk about. over there, I think a couple of things I know are, really high risk factors like sugar. And I read a lot of studies on bacon, for example. And these are the two things I've cut out personally, or at least moderated. Is that is there anything else that would be really high risk factors, nutritionally speaking?
So with nutrition, it's really our nutritional patterns, our
Mm-hmm.
overall patterns that
Mm-hmm.
contribute to cancer risk.
Mm-hmm.
And certainly you've identified sort of two of the top ingredients, if you will, that
Mm-hmm.
are associated with an unhealthy eating pattern.
Mm-hmm.
I would say that the key principle to keep in mind is to try to eat minimally processed foods.
Mm-hmm.
And most foods that are highly processed are rich in sugars and rich in saturated fats and
Mm-hmm.
preservatives and other things that our bodies simply don't need. So
Yeah.
if we aim for a high fiber, plant forward diet
Mm-hmm.
that is minimally processed, with that kind of eating pattern, we avoid a lot of the negative ingredients and chemicals, some of which you've just mentioned,
Yeah.
that contribute to cancer risk.
Yeah. And I know another factor, I mean, you already mentioned it one, but that was diagnosis. Because a lot of your treatment outcomes, how successful they are, do depend on how early you catch your cancer. Um, and I'm going to take this year wise, okay? Because somebody once told me you should get yourself diagnosed. I was 20 and I went for a mammography and I realized I didn't have to. So if I'm under 30, do I need to do any sort of diagnosis for breast cancer?
Right now, there is no screening technique
Mm-hmm.
that has been shown to be effective for
Mm-hmm.
very young women in terms of
Right,
breast cancer screening.
right.
So we're not recommending routine mammography. Now, there are
Mm-hmm.
individual cases, so it's certainly
Mm-hmm.
important to speak with your doctor.
Yeah.
But routine imaging is not right now recommended for young women under
Mm-hmm.
30, partly because the architecture of the breast
Mm-hmm.
makes it difficult, and the risk, I should say, of developing breast cancer, while it is rising in young women,
Mm-hmm.
fortunately, it's still quite low in that age demographic.
Right. And if I'm between 30 to 40, should I get a diagnosis and how often?
So this is where we start to see some rise in the
Mm-hmm.
risk of developing breast cancer.
Mm-hmm.
It's still fairly low. There's about a 0.44%
Okay.
chance of developing breast cancer in the 30s.
Mm-hmm.
So this is where family history matters,
Mm-hmm.
and other risk factors, personal lifestyle risk factors. Right now, routine screening is not recommended between age 30 and 40. But there
Mm-hmm.
may be some exceptions to that, again, family history and so forth. So having
Or
that
if I'm
conversation,
a smoker, for example, and if I'm high risk, then I should get it screened.
high risk,
Yeah.
yes.
And above 40, how often do I go? And for how
This
long? Do I do this for the rest of my life?
Yes, yes. So this is where
Yeah.
we really do recommend starting mammography, annual mammography once a
Mm-hmm.
year.
Mm-hmm.
Now, there is some controversy whether or not screening should start at age 40 or age 50.
Mm-hmm.
I would advocate for starting at age 40,
Mm-hmm.
particularly if the family history. And this is once a year mammograms, which is
Mm-hmm.
the gold standard and has been demonstrated to be our
Mm-hmm.
best screening test for detecting breast cancer.
Mm-hmm.
Some women need to do it maybe twice a year, and that
Mm-hmm.
depends on what's seen on the mammogram and
Mm-hmm.
again, risk factors like family history and other medical ailments. But generally speaking, for most women, once a year mammogram starting at age 40, and you ask for how long, we
Yeah.
do recommend doing that through the balance of life. Now, there are decisions to be made in older age when to
Mm-hmm.
stop cancer screening, but it really varies from individual to individual depending on their health and their function at those older ages. But yearly mammograms starting at age 40 for the balance of life is one of our most effective tools for
Mm-hmm.
catching breast cancer early.
And, we've been using the word high risk. Now, to know that you're high risk or not, there are also a whole bunch of assessment tools. How reliable are, say, an online assessment tool or some of these genetic tests that, place you in high risk or not?
Our risk prediction tools are fairly accurate. We
Mm-hmm.
have scores like the Gale model, for
Mm-hmm.
example, genetic testing, as you mentioned.
Mm-hmm.
But we also have to keep in mind that a lot of these risk models were developed and researched in populations that may not be representative of the
Okay.
South Asian population,
Mm-hmm.
predominantly Western Caucasian populations
Mm-hmm.
where the genetics are different and the exposures might be different as
Mm-hmm.
well. We know that South Asians are at a higher risk of developing metabolic disorders like insulin resistance
Mm-hmm.
than Western populations,
Mm-hmm.
despite having a normal body mass index or weight. And that's a risk factor for developing breast cancer as well.
Yeah.
So I certainly recommend that my South Asian
Mm-hmm.
patients
Mm-hmm.
are very meticulous about starting cancer screening early and
Mm-hmm.
speaking with their doctors about their individual risk factors.
Yeah. And another thing where, I think people aren't always very sure of is what is the best diagnostic tool for breast cancer? Because you mentioned mammography, but there are people who, there are a couple of blood tests now that apparently, show up markers or ultrasounds or, you know, so is mammography still the best? And are there some limitations of it as well?
So when we're trying to judge how good a screening
Mm-hmm.
test is, ultimately the question is, does it help you live longer?
Okay.
Does it extend your survival?
Yeah.
And right now, mammograms are the only test that have been proven to help you live longer, to
Okay.
extend your survival. Now,
Mm-hmm.
there are individual variations in that, and there are some women who have either dense breast tissue
Mm-hmm.
or an architecture that might be difficult to fully visualize on a mammogram. And this is where we sometimes add in an ultrasound to help delineate that architecture. One should also know that there are different types of mammograms. You may have heard
Mm-hmm.
of 3D mammograms or tomosynthesis, tomography. The newer types of mammograms, which tend to be that 3D mammogram, are more sensitive for detecting breast cancer and
Okay.
have become the standard mammography. And finally, you may have heard of breast MRIs.
Yeah,
This is
breast
magnetic
MRIs. Yeah,
resonance
yeah.
imaging.
In fact,
That's
there are a
another.
couple of new equipments I came across where even the radiation levels are being cut down, so you can actually go fairly often for your screenings.
Yeah, yeah. So
Yeah,
certainly
yeah.
breast MRI is an effective tool
Mm,
for screening for breast cancer, except that now we run into that balance issue again, even in
yeah,
these
yeah,
where those breast MRIs
yeah.
can be so sensitive
Mm.
that there's a higher rate of false positives
Ah,
with the
okay.
breast MRI. So I
Yeah.
wouldn't go straight to the breast MRI.
Mm,
That's something we reach for if there's something on the mammogram that's
yeah,
not quite discernible, or if, again, if the doctor and believes that the patient has a very high risk that the
yeah,
mammography might miss for some reason.
yeah,
But the mammogram is our best test, and I would start there. You
yeah.
did also ask about blood tests, I believe.
Yes. Yes,
So
there are a couple of blood tests which apparently show you some markers for cancer.
yes, yes. So I think this is an area that is important to discuss because there
Mm-hmm.
are a lot of companies marketing blood tests for cancer screening. We certainly do a lot of research at Sloan Kettering with
Mm-hmm.
regard to cancer screening blood tests,
Mm-hmm.
and there are a lot of exciting markers, but I would consider these to be very early stage right
Okay.
now. We don't quite yet know what their predictive value is.
Mm-hmm.
And for a lot of people, some of these equivocal blood test results can cause a lot of unnecessary anxiety.
Mm-hmm.
So right now, my recommendation is to keep an eye on those blood tests. It's an
Mm-hmm.
exciting technology,
Yeah.
not quite ready yet for prime time unless you're doing it as part of a research
Yeah.
protocol at a cancer center.
Yeah. And another thing, in India is that because there is a large low income population, and mammography might not be as feasible doing it yearly unless you really feel like something's going wrong. Um, and for a long time, we were taught how to detect lumps in our breasts so that, if you feel a lump go rushing, then the mammography makes total sense to invest in. Are there some other symptoms or signs because the lump diagnosis has been a long time, almost decades since, we've been doing this, checking for lumps. But are there other things that, science has come up with that we should keep an eye out for?
Yes, certainly. So any change in the breast that is persistent
Mm-hmm.
is certainly a red flag and something that should be examined by a physician. Now, the good news is that probability-wise, most changes in the breast tissue are actually not cancer, but
Mm-hmm.
it's certainly something that we don't want to miss. And so,
Mm-hmm.
if a person certainly feels a lump or a mass,
Yeah.
but some of the lesser known symptoms that should prompt one to see a doctor is persistent pain in the breast,
Mm-hmm.
any changes to the nipple. So this is where we sometimes see discharge
Mm-hmm.
or inversion of the nipple, any kind of skin dimpling or puckering, or any kind of changes that is a difference in the architecture or the structure
Mm-hmm.
of the breast that's
Mm-hmm.
persistent, not
Mm-hmm.
cyclical, comes and goes with the person's
Mm-hmm.
menses, for example. That's
Yeah.
typically not cancer related, but something persistent like that are some of the lesser known symptoms which should prompt you to see your doctor.
Yeah. And, even God forbid, were somebody to get breast cancer, um, for me, science and medicine has it's like a comfort blanket constantly. I know nothing can, fully guarantee that I will or will not get it. But then I see how much is happening on the treatment front, and that in India, if it's cotton time, breast cancer survival rates, 5-year survival rates are almost above 90%. And for any stage, it's about 66%, which gives you some solace, definitely makes me feel really good. And so it's 2024. What's new with breast cancer treatment? What are the other things we should be feeling really hopeful and good about right now?
This is a very exciting area.
Mm-hmm.
And as you mentioned, Sonali, an area where we're seeing a lot of exciting progress, new treatment strategies,
Mm-hmm.
uh, and new ways to prevent recurrence of breast cancer
Yeah.
as well. So, one of the things I think is very comforting to keep in mind is if breast cancer is caught early, the cure rate is very high.
Mm-hmm.
This is one of the most curable breast
Yeah.
cancers if it's caught early, and that's why that screening is so important.
Mm-hmm.
Uh, we have new medications, not just chemotherapy, but new types of molecular therapies that have
Mm-hmm.
fewer side effects and are
Mm-hmm.
more efficacious. We have new types of immune approaches or immunotherapies,
Mm-hmm.
different newer types of radiation techniques, for example, that use proton therapy that minimize some of the side effects from radiation. And certainly, a lot of these treatment techniques, which we're excited to have developed and continue to develop at Sloan Kettering, are very effective for curing breast cancer.
Mm-hmm.
And even in the metastatic setting or the stage 4 setting, which we currently consider to be an incurable type of breast cancer, there we are seeing incredible advances in extending both the duration and quality of life with a
Mm-hmm.
lot of new medical therapies. It's
Mm-hmm.
a very exciting area of research with
Yeah.
new therapies.
Yeah, and you come across new things all the time. So something new that I came across when, I was looking at what Memorial Sloan Kettering is doing is exercise oncology. And I wanted to ask you, can exercise be medicine?
I love that question because exercise is one of our most effective lifestyle modifications for
Mm-hmm.
both cancer risk reduction and improving outcomes after a cancer diagnosis. And the wonderful thing about exercise is
Mm-hmm.
that we know from multiple clinical trials that it reduces a lot of the side effects from cancer therapies and it lowers a lot of the symptoms from the cancer itself. So, on
Mm-hmm.
top of helping a person feel better and improving their quality of life, we're now learning from a lot of the research that we're doing in our exercise oncology program at Sloan Kettering that the exercise itself can modify many things in our body, like the immune microenvironment. It can
Mm-hmm.
modify the breast tissue itself. and it can modify hormone signaling in a favorable way in our body to protect us
Yeah.
against the breast cancer. So it's a
Yeah.
very effective treatment strategy, if you will, when we use it in addition to our traditional medical therapies.
Yeah. No, in fact, very often we hear exercise and we think, it's like some high intensity movement. Um, but I have noticed, when I was going through some basic anxiety treatment, walking itself is so powerful. And I read and I found out that the nerves in my feet, which actually trigger the release of happy hormones, and then it helps you with anxiety. But anyways, in a larger sense, I also feel, as human beings, we were born to walk, right? We're born to move, not sit all day. So there must be some um, links between the two and our
Absolutely.
health.
I,
Yeah.
I
Yeah.
fully agree. You're absolutely right. And we know that sedentary lifestyle where we're not moving is a risk factor for
Mm-hmm.
developing multiple different types of cancer. So as you
Yeah.
said, where our bodies are designed to
Yeah.
move and we need to keep them in motion.
Yeah. Are there some particular forms of exercise that you're looking at for cancer treatment or post-cancer lifestyle management?
Yes, so aerobic exercise
Mm-hmm.
or cardiovascular exercise
Mm-hmm.
appears to be one of the most effective types of exercise for
Mm-hmm.
mobilizing a lot of those protective pathways that I mentioned,
Mm-hmm.
like the hormone changes and the immune changes that protect us against cancer.
Mm-hmm.
So we certainly recommend doing either moderate or even vigorous activity
Mm-hmm.
that gets your heart rate up. There are now multiple professional guidelines and international
Yeah.
guidelines recommending about 150 minutes per week of moderate intensity exercise. That could be like a brisk walk. That
Yeah.
could be like a game of tennis, the more vigorous side, and so forth. But
Yeah.
we also know that resistance training, either lifting light weights
Yeah.
or
Yeah.
things like resistance band,
Mm-hmm.
can be helpful for things like our bone health and our muscle mass as well. So it is also recommended to get at least 2 days per week of resistance training in addition
Mm-hmm.
to that aerobic exercise.
Yeah. And are there any other lifestyle modifications which one might be looking at as potential cancer treatments or part of cancer treatments?
Well, I certainly think that living a lifestyle in balance, if you will, is helpful for reducing cancer risk. And
Mm-hmm.
we've learned from our research that certainly exercise, for all the reasons that we mentioned, is important. We've
Mm-hmm.
talked about nutrition. Nutrition is incredibly important. Maintaining a healthy body composition, and I think this goes deeper than somebody's weight or body
Yeah.
mass index. This is the ratio of your fat to
Mm-hmm.
lean or muscle mass, and
Mm-hmm.
maintaining the fat mass that is healthy, less than 30%,
Mm-hmm.
is important and can be achieved through both exercise and nutrition. Avoiding environmental exposures that are known carcinogens like smoking, alcohol use, excessive exposure to sunlight, although exposure to sun and being outdoors is helpful. But these are environmental exposures that are helpful to minimize, to lower our risk of developing cancer, and also maintaining a healthy balance in our lifestyle. So exercising, not being overly sedentary, following some of those exercise guidelines that we talked about, and eating a minimally processed, plant-forward, high-fiber diet can help to lower our risk of developing breast and many other types of cancer.
Yeah. Well, thank you very much for everything that you've shared today because I think when one hears from an oncologist and not from Google, the sense of balance becomes a lot easier to incorporate in one's life. So thank you so much for everything you've shared. Thank you.
My pleasure. Thank you for having me.
Thank you. Sometimes I feel as women, we have such high expectations of ourselves that we forget relaxation is an achievement too, and that a relaxed body and mind is very important for a woman's health as well, because, in particular, because of all the hormonal stresses we are liable to face anyway. So, the choice I have made for balance is that I won't go mad escaping all the triggers or potential triggers for hormonal imbalances. I'll take care of the major ones, but I'll also invest a lot more in what I can control, which is my peace. I'll allow myself time to relax and not let anyone judge me or question me as to why today I want to do nothing more than just sit and stare at the clouds. I can't entirely stop every risk of disease in my life, but I can match it with a fair amount of positives, and relaxation and de stressing has been known to have a wonderful benefit on your life. Has this episode helped you learn a little bit more about your health? And if you were stressed about menopausal diseases or breast cancer, do you feel a bit better now? Do send your thoughts to us on pods@indiatoday.com or on 8588 966 You can also rate our podcasts. We are available on Apple, Google, Spotify, and YouTube.